Welcome, folks. Please feel free to say your name, say a hello in the chat. We wait for folks to, people are still entering from their waiting room.
Can't get the chat to come up. Hello.
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 Hi.
Welcome, everybody. We're just going to take a minute to let people start coming in.
Thanks for spending a sunny evening with us. This is awesome. So many people showing up.
It's a program.
How are we doing, Claudia? Do we look like we're getting so waiting room finishing?
Let's see here. I usually like to give it, about 5 minutes for people to shuffle in and then get
All right.
started. But yeah, looking good.
Always fun to get a look at folks and see where people are coming from.
Yeah, I even chose a special background for today for Women's Solidarity Month.
Great. See Rebecca. Awesome. So remind folks, if you want to mute yourself, that'd be fantastic. You can hear some background music.
All right, we're 5 minutes in. Should we go ahead and get started?
Let's do it. Yes, welcome. Welcome everybody to Third Thursday. I'm Ann Tracy. I'm with Women's March Minnesota. I'm part of a team that's been working on this project. We've got Claudia, also from Women's March. We've got Heather from ERA. Ooh, yep, if somebody wants to mute themselves, someone who might be moving something, that would be fantastic. We can all right, yeah.
So Anne, you are muted.
I was gonna say, I just got automatically muted. I'm hoping not, okay. We'll get it all together. We'll get it all together. Just to let folks know, my computer restarted itself. It's still going. It started 45 minutes ago. So it's all on the fly today. That's how we're doing it. So this is Third Thursday. I don't know if people got to hear, but we want to give a nod to our silent partner today, Mary from Women's March Minnesota, who did a ton of work on this. And she's with us, but she's quiet today. Third Thursday is something that's been happening for 3 or 4 years. It used to happen in person. Folks would gather and learn about different legislative topics or get together, talk about things that were of shared interest. Of course, This, I think, is the 1-year anniversary of going virtual, and we all know why. So what is nice is it's nice to see people's sunny faces. Just a little bit of housekeeping, as I said, it sounds like folks are muted now, so that's fantastic. If you have a question as we're going along and want to put it into the chat, we'll sort of be moderating those questions as we go along, which is fantastic. We are recording this this session, so if you are recording a verse, feel free to remove your name or to take yourself off video. That works well. We'll be getting back to folks later about if we're going to do anything with that recording, but just so folks know. A little bit more about the Third Thursday. I want to thank all of the Third Thursday partners, the Women's March, ERA Minnesota, Minnesota Indivisible Alliance, Indivisible to All. So without further ado, I'll get into the agenda a little bit. We're here really to talk about the impact of the COVID crisis on women. And we have some speakers I'm excited to hear from. Starting with, we've got Christina Ewig from the University of Minnesota, and she has a publication. If you haven't taken a look at it, I tweeted it earlier today from the Women's March, and we'll put a link for it into the chat. COVID-19's unequal impacts on the Minnesota workers, a race and gender lens. Obviously, we're all living it. So some of the recommendations, some of the short-term and long-term recommendations that I've made in that report, I think are amazing. So I'll be excited to hear more about that. We also have 2 senators with us, and we're excited. So we'll first hear from Christina, and then we'll hear from Senator Knish from Senate District 41, previously from the House from District 41B, the first Indigenous woman to serve in the Minnesota Senate. So thank you, Senator, so much for taking the time to be with us tonight. We've also got Senator Melissa Franzen from Senate District 49, who's Assistant Minority Leader. So she has been in the Senate since 2013. So it's we thank you all for joining us. As I said, I'm kind of going on very limited notes. Let me know, team, if I've forgotten anything. All right, then I'm just going to hand it off to Christina. We'd love to hear more about the report and your information.
All right, thank you, Anne, and thanks to Heather and Mary for reaching out to me and inviting me in the first place to be here, because I'm really excited to speak with this group. I haven't been able to make the Third Thursdays in person, so virtual actually works well for me, and having kids at home and all that. So, so I am Christina Ewig. I'm a professor of public affairs at the Humphrey School of Public Affairs at the University of Minnesota. I also direct the Center on Women, Gender, and Public Policy. We do, as a center, a number of different things, including events on issues of interest, training, especially we oversee the training of our graduate students in the area of gender and public policy. And we also do research, usually research focused on Minnesota. You might know the Status on Women and Girls in Minnesota report that's published by the Women's Foundation every 2 years. And that's research that we do for the Women's Foundation and in partnership with them. But we also do other reports at different times. And about a year ago, this time, I started getting a variety of calls from the media asking, why was it we were seeing more women being laid off than men in our initial unemployment figures? And I had a pretty good idea of why this was the case, just from having done the status report on women and girls for many years with the Women's Foundation. But I decided I wanted to dig in further to really understand what kind of impact COVID-19 was having on Minnesota workers. So I put together a research team over the summer. I hired 2 students, one Master's of Public Policy student and another a PhD student in Applied Economics. And the 3 of us worked over the summer to put together both quantitative and qualitative data to really understand what kind of impact we were seeing and how that impact broke down along race and gender lines. There was a lot, if you recall, and we can still see in the media, often you'll see a story about women or you'll see a story about race and COVID, but we didn't see what that intersection was, what was going on when we looked at race and gender together. And so that was the objective of this research. The quantitative data we used was principally the American Community Survey. That allows us to see which workers are in which sectors of the Minnesota workforce. And we also looked at the unemployment claims from DEED, from our Department of Employment and Economic Development, and analyzed those by gender and race. In addition, we wanted to know how workers were dealing with the dislocations caused by the pandemic. And that you can't, the statistics are useful, they give a broad picture, but they don't tell us what are people doing when they are laid off? What are they doing when they are an essential high-risk worker and are concerned about bringing the virus home to their loved ones? So to get that kind of information, we did a purposeful sample with a selection of community organizations as well as unions. And so by purposeful, I mean, we chose community organizations that represented each of the major immigrant, ethnic, and racial groups in the Twin Cities metro. We had fewer interviews outside of the metro, as well as organizations that served a broad range across different race and ethnic categories. In addition, when we spoke with unions, we chose unions that covered all sectors of the workforce that we were concerned with, where we saw major sectors impacted by COVID-19. So that's how we went about our research. I'm going to share with you now some of the findings of the research. And so I'm going to start by sharing my screen. Hopefully that works. Yeah. Okay. So I'm going to go over our key findings, which break down into three. There's one big overarching finding that we have, and that is that women workers, especially women of color, have faced a dual vulnerability. They are either in high concentration in high risk essential jobs, or they have been at higher risk for layoffs. A second big point that I'll make is that we see very high rates of layoffs for women overall, but especially for communities of color, Native Americans and Blacks in particular, though I would say that our layoff rates are probably not reading the degree to which layoffs have impacted undocumented workers. So, but these layoffs threaten long-term gains that we have seen for these groups over decades in the workforce. And the third key finding is that we've seen the pandemic magnify the gender, racial, and ethnic disparities of our social priorities. And that's something I'll explain later. But I think where we've been placing our priority historically and during the pandemic really has been unequal in terms of how the impacts have hit different kinds of groups. So first, to that first big point, this dual vulnerability. How do we get to this? We took the Minnesota workforce and divided it into four categories. We often hear about essential workers, but there's a big difference between being a truck driver, driving across country alone in one's cab, compared to a bus driver driving around the city and picking up individuals at each street corner. Right, one would be both are essential workers. One would be a low risk essential worker because it has that individual has very little public facing time on the job, whereas the other has a lot of public facing time on the job and therefore has been at higher risk for contracting the COVID-19 virus. So we take essential workers and divide it into two groups, those that are high risk and those that are low risk. We then select those occupations. We use a combination of data to come to this group, but those groups that are most able to work from home. And then a fourth category of those who, based upon their industry and occupation, are most vulnerable to layoffs. So these are estimates that we make. I think they're pretty good estimates. But what they show, if you look at this graphic, is on the left-hand side, you see the high-risk essential workers, and the red being women and the blue being men. And we see a majority of women in high-risk essential work. Whereas that low-risk essential work, think construction, think the long-distance truck driver, those are predominantly men. Able to work from home, we see pretty even between men and women. And then again, we see a spike for women in vulnerable to layoffs. Think about the kinds of jobs that we saw, especially in the lockdown periods. And this is the period that we measure later when we look at the actual deed data. This is when we see restaurants close, beauty shops close, parts of healthcare that was non-essential healthcare was closing. And so we saw layoffs in all those areas which are predominantly women. So here's where we see that dual vulnerability. How do I know that it's women of color? I've stated that it's predominantly women of color that we have as our finding. Well, I'm going to show you a wonky graphic next. And this is where we take all of the workers in the high risk essential category, and we look at how they break down by race. So on the left-hand side, you see in bold the major racial ethnic groups that we tend to use in this kind of analysis. What we like to do at the Center on Women, Gender, and Public Policy is, to the extent that we can, we try to break up the groups Asian and Black into the major categories that we see in Minnesota. And those are the ones that we see in italics on the side. The red is, again, women, and the blue is men. And we can see that no matter what the racial group is, women vastly outnumber men within each racial category in terms of their proportion that they make up in the high risk essential workforce. So this is, again, it's based upon the proportion. So among all Asians in the workforce, 40% of Asian women in the workforce are in this high risk essential category. We also see very high numbers of Native American women, almost that 40% mark. And then what's interesting is that when we break down that category of Black between Somali and African American, we see many more Somali women than we do African American women in this high risk essential category. So what does this mean? You might be like, oh, here we're breaking down, we get all this detail. And for researchers like me, you know, it's like, it's interesting to see that nuance. But the reason it's so interesting is because of the policy implications. I also know from the work that we do on a biannual basis for the Women's Foundation of Minnesota, the status report that I mentioned, that we regularly break down the wage gap, the gender wage gap in Minnesota among these different categories. And when I break down that wage gap among these different racial categories among women earn just 55 cents for every dollar a white man in Minnesota earns. Native American women, 54 cents, and Somali women earn 44 cents. And these three groups in the previous slide you saw as being disproportionately concentrated in high risk essential work. So we are depending upon women who earn the least for the most critical work that we've had taking place during the pandemic. And that is something that I think we need to address. All right, so that is one side of the vulnerability. The other side is layoffs to that dual vulnerability. Here in this figure, these are unemployment claims data between April and May. So at the point in which we had most closures due to executive orders. And we can see, and when we looked at the data again in the fall, when we had some more closures, we were beginning to see the same kind of pattern emerge. So what we see with these closures is, first of all, now here I don't have as nuanced of categories. That's because the Department of Economic Employment and Development does not break down Black into the different categories, for example. So we can only rely on these 5 categories. But if you look across these groups, again, we see, except for in the category of Black, we see the red line larger than the blue line. So women in every racial category except for Black are being laid off at higher rates than men. But it's especially concerning when we look at Native American and Black. That's where we see disproportionately higher rates of layoffs for these groups. And it is concerning in that we didn't predict when we did this research that we would see Black men have the same numbers of layoffs percentage-wise as Black women. We expected to see a gender difference in those groups. So that is the second part of the dual vulnerability, is these layoffs. There are a number of things that the layoffs miss that I want to talk about briefly. These layoff figures, these are just unemployment claims. So that means you have to be able to claim unemployment. And we have many undocumented workers in the state that may actually have tax ID numbers and are paying into our unemployment system, but who cannot claim unemployment. So for those groups that may have high numbers of undocumented workers, they are not represented in this figure. And so we're likely seeing higher degrees of people who've lost their jobs than what these figures show because of missing that. The other thing that these miss is individuals that choose to leave the labor force. So you can only claim unemployment if you have lost your job because your employer has laid you off. You cannot claim it if you decide to leave your job voluntarily. So for voluntarily leaving a job, what we're seeing in the state is high numbers of women. And this data comes from the Minneapolis Fed. Shows that women's labor force participation between September and November of 2020 in Minnesota dropped by 11%. We are known as a state with among usually the first in the nation for women's labor force participation, and we've seen a dramatic drop. And a big reason for that is it is mothers with children under 5. That are leaving the workforce. And also mothers, another report by the Fed showed that mothers with school-age children were more likely to take a temporary leave due to the stress of having to manage childcare and work at the same time. So these figures don't tell us that voluntary leaving, but we're seeing a gender dimension of leaving the workforce due to that care work that women are responsible for. This is some data from prior to the pandemic. I mean, the thing is, when the pandemic happens, we don't necessarily have all the data or the research set up to measure. And in fact, one of our best measures of measuring who takes care of the kids is the American Time Use Survey. And the Census Bureau that runs it decided to suspend it during the pandemic, which is exactly when I really wanted to know who was taking care of the kids when the kids were sent home from school. But we do know that prior to the pandemic, women spend more than an hour a day, more than men, in taking care of kids among those that have children under 13. And we know from stories and newspaper articles and so on that that inequality that is already within households has been exacerbated. And that's what we see then happening with more women voluntarily leaving the workforce. Okay, so that's layoffs and where we see things. That has some really long-term potential impacts. As I said, as my second key point in the first slide, one of the long-term potential impacts is erasing the gains that we have made over time, both in increasing numbers of women, increasing numbers of underrepresented groups into the labor force, into good paying jobs, into increased wages and narrowing of the wage gap. Anytime individuals take time out of the labor force, they are losing their overall lifetime earnings, and they're also losing the chance for a raise and incremental increases that individuals that stay in the labor force are likely to get. In addition, when we saw those high numbers of women experiencing layoffs, because of the wage gap, women often have less savings. And so especially single women-headed households, when we see a layoff, we will see these families wipe through any savings they may have. And that's savings that could have been put, rather than towards putting a roof over one's head, putting food on the table, that savings could have snowballed into investing in children's education and investing in one's own education, buying a car in order to get to work, any number of things. So these are the long-term impacts of the layoffs that we're seeing, that with both gender and racial dimensions. The third big point that I made on the first slide is that the pandemic has magnified the gender and racial inequalities of our social policies. When we went and did our community interviews, and then followed up with some of those interviews in November when we were ready to release this report, I was frankly shocked at how union leaders in the nursing sector, in the healthcare sector, were telling me they still didn't have adequate personal protective gear. Community leaders told us that childcare was already scarce prior to the pandemic, and now it just became even more scarce. Or they talked about there was childcare available, but people were really scared to send their kids to school. So what were they, or to childcare providers? So what were they going to do? So in the broader view, one conclusion we have here is that when we think of some of those areas that were especially lacking, personal protective equipment, childcare, especially for school-age kids, because in Minnesota, the state did a pretty good job of ensuring that childcare centers were open, even if people were scared of sending their kids there. But there wasn't anything for families with school-age children for the most part, unless they were a tier 1 essential worker. So those areas that impacted women the most, when we think of those high-risk essential workers that are the lowest paid that I mentioned, not having PPE when they went into work, and other women not knowing what to do in terms of balancing a kid at home, and if they were lucky to have a job, to continue working from home. Other pieces worked well, and the pieces that worked well are ones that we traditionally, historically, are systems that were built with a male worker in mind. The stimulus checks and the unemployment insurance worked pretty well. But as I mentioned, undocumented workers were left out of that scheme altogether. So we see some real inequalities in terms of how these supports are supporting some groups and not supporting others, and they're gendered and racialized inequalities. All right, so my big take-home point here is that when we think ahead in terms of policy, it's time to value women's work. And by that, I mean thinking about valuing women's work, whether it's on the job or at home. So those workers that are in the high-risk essential categories that are majority women, and many of whom are among the lowest wage workers, we need to increase wages in that sector. But we could also start by providing some better basic working conditions, whether it's healthcare, sick leave, or other kinds of security in those jobs. And the other piece is support for care work, whether it's childcare, whether it's elder care. That section allows women to work and earn and provide long-term investments into their families. I'm just going to talk about the longer-term policy proposals that we make in this report, or recommendations that we make in this report, rather than the short-term ones, because now I feel like we're moving into that horizon where we really do need to think about how do we lay a foundation for future resilience. I think it's time. I think we're all thinking this, right? It's been the rhetoric since the beginning. Here we have this major pandemic, and it has really exacerbated existing inequalities that we have in our society. And we all see this in so many different ways. How in the future can we build greater resilience and put in place ways in which we don't see in a future pandemic, which is likely to come, where we don't see that exacerbation? So the first recommendation long-term out of this report is to decouple health insurance from employment. You know, that's something we can't do at the state level. There's lots of different proposals for reforming our healthcare system at the federal level. I do think the opening up again of the Affordable Care Act, as has happened in the past month, for signing on to it is a great step at the federal level. But the very idea that you can lose your job because of layoffs, or need to leave your job for some other reason and also lose your health insurance just doesn't make sense. We need to have a solution where we have a decoupling of those two things. The second point is replacing the current patchwork of economic and social supports. One of the things that we heard from our community leaders in doing the interviews for this was that the CARES Act and other monies that were coming in at the federal level and then coming through the state provided some great supports, but we have a problem of a benefits cliff for many of our community members, where a lot of care has to be taken that if they get too much of one benefit, they may lose another. If you earn too much of a wage, you may lose your health insurance. I mean, that's something regardless of the pandemic, but just as one example. And so this patchwork of economic and social supports causes a huge amount of bureaucracy at the state and federal levels, also a lot of stress for individuals. So I think the stimulus payments have actually been an instance of a universal income of sorts. And we might think about as a country moving towards a more universal income kind of situation. And I can talk more about that. I also know that community organizations are really working towards innovations in this area in Minnesota, but they bump up against these federal regulations where they can't innovate in some of these areas of our welfare supports. Third point, and this is more actionable, I think, at the state level, is to think about all the things that came out in the CARES Act, the big act that was passed in June and expired in December. A lot of this I saw as a wonderful social experiment. For the first time, we actually had paid sick leave. Other than in Minnesota, we've had it, of course, in St. Paul and Minneapolis. But this is quite an innovation to have paid sick leave, and that was in the CARES Act. It happened. Why couldn't it be long-term? In a pandemic of all times is a time that one needs sick leave. And this, we have the Women's Economic Security Act in the Minnesota context. With more people with sick leave, that has limitations. You have to have sick leave, but in the Women's Economic Security Act, you can take advantage of sick leave to take care of other family members, not just yourself, but only if your employer offers it. If we had greater coverage of that, we would also see more people being able to have that flexibility. Paid parental leave, there was was also part of the CARES Act related to being able to take care of sick family members. And that is crucial in a pandemic, but it's also something that can be long-term, a real help, especially for our lowest paid workers who don't have that as a benefit and often have to leave the workforce altogether and lose that income when they do have children with needs or other family members with needs. We also saw expansion of UI coverage under the CARES Act to include gig workers and some other workers that aren't normally covered. And I think that was an important innovation. So thinking about ways in which at the state level, we could be implementing some of these broader things that were done under the CARES Act. And then prioritization of childcare and education in future emergency planning. I do think that the state has been prioritizing childcare providers, and I hope that it will continue to do that. And that's important. We need to have preschool providers for working families. In this case, families that had school-age kids were really left out in the woods. And so we really need to think about how do we, in a future pandemic, address care for school-age kids. And that's something, I think there's been a lot of talk about whether we prioritize opening schools or opening restaurants. And to me, that's really a gender question. Which area are we prioritizing, especially when one can lead to the opening, the education and kids in school could lead to the opening of the rest of the economy. All right, and so I will end there and stop sharing my screen and go to questions. Figure out how to shout.
Or, you know, what we might do is leave questions until after the senators have spoken as well, if you're okay with that.
Oh yeah, definitely.
Yeah, and I'll remind folks that if you have questions, please put them in the chat. That'd be fantastic. And as I said, we've got Senator Knish and Senator Franzen, I believe, are both here. I did the introductions earlier. So Senator Knish, would you like to start? Kind of respond, let us know what's happening.
Yeah, thank you very much for putting this on this evening. And thank you, Christina, for this incredible information and research that you've provided. I actually read up on your report in order to get ready for this tonight. So I'm really glad to see you run through it and share some of those really important, vital points. You know, data is what moves so much of the things that we do in the legislature. And I'll just do a quick introduction too. I know that maybe you introduced me, but I'm Senator Knish. I was elected to the Senate this past November, but served 4 years in the House of Representatives before crossing the street and into the Senate. And these issues around equity or inequity with women are so vital as we look for ways to provide the resources for our families to thrive in whatever community that they live in or whatever profession it is that they choose to work in. And this COVID pandemic has certainly exacerbated many of the efforts that we have worked on so hard through the years to ensure that if you're a single mom, you have a job that will support you and your children, that your children have health care when they need it, that you yourself as a woman are receiving top-notch education and skill building, and also that our children are doing that within their schools. We want to make sure that we have roads that you can transport yourselves on in order to work and to enjoy life. And we want to make sure that we are growing our economic opportunities within the state. And we just saw from this presentation that we may have taken a few steps forward, but we certainly have taken many steps backward. And it's going to take a really collaborative effort in order to build a better economy that is better suited to women and families. I carried the ERA amendment that would be a constitutional amendment in the House, and fortunately we passed it in the House once again. It was not heard in the Senate. I'm carrying that bill again now in the Senate and have not had a hearing, and I'm pretty convinced that I will not have a hearing on it in order to move it forward. We've already had our first deadline. Things can happen in the Senate, but under these circumstances, I don't think that we will. But it is just so important that we are working towards that economic security for all, and really appreciate having this information as a basis for possible legislation and funding going forward in order to ensure that we do have the kind of economy that works for everyone. So thanks for all of you for being here, and thank you again, Christina, for this fascinating information.
Yes, thank you, and thank you for all of your hard work. And the ERA, we keep hoping, but we appreciate that. So that's yeah. It's been a good week nationally, but we need some state stuff.
I see Representative Bonner is here. Representative Bonner is carrying the bill also in my partner bill down there. I see her, so it's like, you know, House Squares or whatever. Yes, she is carrying my companion bill in the House, and so one of these days, okay? One of these days.
One of these days, yeah, exactly. Well, thank you for the update. Now, Senator Franzen, I did the introductions before, so I'll just kind of jump you to it. Let us know what's going on.
Thank you. Thanks for having us. I found this in my desk today at work. So thanks for giving that up to us. Before, I don't know how long I've had it, but I also, you know, wear my swag as well. So it's great to have more women in the Senate, I have to say. So welcome, Senator Kunish, and maybe Senator Bonner someday. We need more women in the legislature overall in politics. And this is one of the issues, reproductive rights, which for me is paramount. For those of you who don't know me, I know you introduced me, but I do have 2 little kids, 4 and 5, and they're little miracles. And a lot of reproductive medicine was used to achieve the first one. So I do not want government in meddling in that decision. Many times I've served on Health and Human Services the majority of my 8 years in the Senate. And many times I was one of the lone voices on the committee, not just myself, Senator Eaton, and I'm trying to think who else was on HHS, but just a handful of us on the floor talking about, you know, anything from contraception to safe abortions to women's reproductive rights, and it's hard to do that in a context where you have to share your own stories, which are very personal and very private. But that's the only way I think we make headway with a lot of men and a lot of Republicans, quite frankly, who think this is about, you know, taking the women out of the equation and putting them in the workplace, and then the man is stuck with the kids. I mean, look at this pandemic. I mean, I feel like it's been this archaic way of thinking about how the world operates. Without women in the workplace, without women doing and balancing and multitasking, the economy would be far worse off. And now we know that we need women back in full force, and it's going to take it's going to take a time, right? Paid family leave. Every time I get an opportunity to talk about it, I'm a small business owner. Yes, I believe paid family leave is a cost that we have to put ingrain in the system, because after this pandemic, you can't argue that we don't need a safety net for families to take care of themselves, their loved ones, their kids. Everyone's been balancing, so don't let a crisis go to waste when it comes to paid family leave. I think this is where we should strike while the iron is hot. I'm glad that we have a Democratic House, and the Senate is quite the different story, right, Mary? It's just today we were debating emergency powers and stripping them from the governor because we don't believe in data and science. And the same thing with reproductive rights. Data and science is saying, you know, that we want safe abortions. We're not saying there can get, you know, you can get them anywhere. There's protections under our Constitution, protections for life. But when a woman needs to make the decision with their spouse, with their partner, for themselves, that is and should be their choice, not the government. So is it Alabama, Arkansas, right? Was the last one, the state that just passed the abortion restriction, and that the governor signed? Was it Arkansas or Alabama? It's an A. Anyway, it's just a way to get back to the courts. And I'm a lawyer by trade, so I've always watched the Supreme Court and how important it is to have great justices there that could see things with the woman's lens. But obviously, the court has been moving more conservative, and that is really a concern for women's rights. And we have to continue to fight for them. It doesn't get easier. The players change, and we have to be vigilant every single day because they are being eroded everywhere. So this is a movement. I watched the ERA, what is it, the Hulu Mrs. America, and I was just like, oh my God. So this is just a fight that we have to stick together, that we have to educate people, because this is not you against us. This is all of us together, right? Families, women and men, we can all succeed. And it just seems to be just shifting towards a very partisan issue where it really wasn't initially, right? To a certain extent, it became much more partisan when the abortion piece came into the equation. But I think it takes education when we talk about those difficult issues, knowing that abortion is rare. And when you do have one, it's for very, very, at the end of a term, it's very, very important reasons and critical reasons of life and death. So of the mother and the health of the mother or child. So these are things that they're uncomfortable to talk about, but I think we need to talk about them more because they're still kind of taboo. People think, I don't even know what they think, but I know this group has to keep educating legislators, has to keep educating women about how they can, take control of their own destiny. And obviously, who wouldn't agree that we are all equal under the law, but still so many laws keep putting women in the back burner and keep hurting women. And I think the paid family leave piece is paramount. I think that is one other thing that we need to really fight for, as much as we have to fight for ERA, because those are women's issues that control our destiny, right? So thank you, Heather, for all the work you've done for many, many years. And our fearless leader, where is Representative, Betty Folliard, former representative, who's done such a fantastic job bringing this torch forward in the legislature. You have to be there every year, every day, all the time, and spread the love, spread the education, spread the wealth, and bring others with us, men and women. I know there's a Scott there. I see a Scott. Are there any more men in the group? Alex, maybe it's a woman, maybe it's a man, but thank you for being here and being part of our group to support all of us, support families, support women. I have 2 little boys. That's the only, I'm going to teach them how to be respectful women and how to support women. And they see their mommy working really hard. And I hope that we can spread that in the next gene pool. Thank you for having me.
Thank you. And thank you for telling the stories when they need to be told. I mean, and helping to lift the voices for those folks who can't, and raising the voices for all of us. So again, if you have any questions, put them in the chat. And I think Claudia, you've been looking at them. And
yeah, so I have a few questions here we can get to. Thank you, senators and Representative Bonner, for attending today. I have a question. How do we get bills that will help women, like paid family leave, earn safe and sick time, COVID child care provider assistance, through the Minnesota Senate?
That's the $1 million question. I think it's really going to have to come down to a change in the majority party. I don't see in the next year or even 2 or 3 the GOP championing or changing their minds on those issues just too much. And maybe Senator Franzen can say a little bit more about that, having been in there for so long. It spoiled me to be in the majority for 2 years in the House. And I know that the paid family and medical leave is really a top priority for our Senate DFL. We absolutely care about each other and our families. And I don't think there's one of us on this panel that don't believe that Minnesotans should not have to choose between taking care of themselves and a loved one or going to work and getting a paycheck that they can live on. I have a daughter who's pregnant, and we were talking about her leave time for her maternity leave, and she just started a new job, and she thinks that she'll have 3 weeks saved up by the time she delivers her child. And we're just, in this day and age, 3 weeks is not enough for a new mother to go back. It's not good for the child, it's not good for the mother. And it's just so important that we continue to work on in achieving and reaching the a really equitable way for paid family and medical leave. And so I think what we need to do is that we need to flip the Senate, and then we can start really working on that in earnest. And maybe Senator Franzen has a more optimistic view, but
I don't disagree that we have to flip the Senate, but I think in the environment we're in politics nationally, where it's been more extremes, and I would say on both ends, but on the conservative side is extremely conservative, that they have to line up with the agenda, and this is not one of their priorities, obviously, and certainly not something that they would normally support. There's some people in the middle of the road, very few, but they're in lockstep. I think they're pretty militant when it comes to their caucus of how they proceed with these issues. I mean, we've seen it with the issue of conversion therapy. There were some members who wanted to vote, Republicans who wanted to vote to ban conversion therapy, and that was not a position that the caucus supported. So they silenced those members, and they were not able to vote to support the ban, which is sad, right? It's sad that these issues have to be so partisan and really not open to discussion, and it's yes or no. So I think it's going to take a flip. I just think the parties, you know, we say we have a bigger tent. A lot of people don't like saying that, but we have more ability in our party. A lot of members, I mean, they vote their district and their conscience, and we're Democrats, and we support that individual choice. But at the end of the day, we support democratic values. And I just, on the other party, it's just become more and more conservative when it comes to reproductive rights, when it comes to anything along the lines of GLBTQ rights. And it's just really, really, really frustrating. And we need to, we need to vote more people that think like us, that think our values and support our values, that are, or even open-minded to vote against their party, so they're able to support this. So I think it might take the next election. We have an upcoming election in less than 2 years, that we will flip how the House and the Senate look, and the governor. So it's imperative that we continue to support people that believe in these values and want to make change. Otherwise, it's going to be hard to do. I don't see a path in the Senate on something like this. And I'm sad that when I first joined, we had the opportunity. I joined when I was, it was 2013. We had the trifecta, the House, the Senate, and the governor. But I was probably too new into politics in the Senate to understand that when you get the power, you have to go full force. So at this time, we have it at the federal level. So the game is there right now. So go full force at the federal level, get that extension, and let's pass it. And I think, I'm jealous of Virginia, who is the 38th state, that Minnesota couldn't be that one. But it doesn't mean it's over. And there's room for improvement for us to change the history of the ERA for the good. So again, it takes the next election. So we have a lot of education and a lot of work to do.
And
Thank you, Senator.
And I would also say, I really appreciate our faith-based organizations and the other organizations like Take Action and some of these others that are just relentless in fighting for this and getting the message out in so many different ways, as many different ways within social media or, rallies, all of those sort of things. I just, there's no way that we as elected officials could really move the dial in a way that all of these different organizations do. And it's going to take all of us and a concerted effort to get some of these things over the finish line in order to really have a kind of Minnesota that reflects our communities. So if you are one of those members out there, or somebody in these different groups, please thank them and support them in any way that you can.
Thank you, Senator. I think you are amongst a group of progressive women who are very active. So you're in the right room here.
Good.
I want to take a couple of other questions before we have to go today. Somebody says, I've read that the state will be getting a significant amount of money to put towards daycare. and there are many diverse plans. How might this data be used to inform best ways to spend that money? I don't know if anybody has a comment on that. Maybe Christina might also.
I don't know the details. I think it's around 200 and some million dollars is coming to state. And I know I was part of the first negotiation where Minnesota was the first state in the nation that put $30 million of state funds to prop up the industry. So it could be just as easy as doing something like that. And they've updated how the grants are being distributed, but it was family, day, childcare, and also centers. So it was very much, and it was statewide to make sure that we had diversity there. But there's so much angst, and like I mentioned, one of my kids, 4 years old, still goes to childcare. Childcare is extremely expensive. We just heard a bill, I think it was yesterday or today, all days are running together about providing childcare, having like an ombudsman. Like there's so many hurdles and so much red tape, if you will, to a certain extent, but at the same time, we don't want to cheapen childcare. We want to make sure that we prop up the industry, because that's where our kids, that's their first step into schooling, where 90% of the brain development happens before they're age 5. That is critical time. And we know that that industry is heavily women and heavily minority, and their wages are subpar. So we know we have that's a huge women's issue. If we don't have childcare, it's hard for us to work. But if we don't have quality childcare, the whole family, frankly, is hurt by not having that experience and getting those youngsters ready for K and for life. So I'm really interested in this issue. So is Senator Wickland, Melissa Wickland, that also shares Bloomington with me. We've worked on the issue, and we want to make sure that we have diversity in the profession as a pipeline also to the education field as well, that we know we have a lack of diversity of women and men, just diversity overall in our education K-12 system. So we have a lot of work to do, but I think we have an opportunity again to lead. And there's a lot of things that we've done in the past. I've been supportive of scholarships we don't have, and those would be targeted scholarships for folks. And that can be controversial too, but in the absence of universal childcare, and meaning for me that everyone who needs it and can't afford it or is able to access it just like anyone else around the state, we need to lower the cost, but it doesn't mean we're going to cheapen the way we take care of our kids and the industry. We need to prop it up. I don't know if that answers the question, but it certainly gives you a little context.
Yeah. And I know in the Senate, we have Senate File 469, and it is authored, the main author is Senator Wickland. I've signed on to this, and I know that my Senator friend, Senator Franzen has also signed on to it. And this is a child care provider assistant that will replace certain state funding with COVID-19 federal fundings. And I think it's the fundings that you're talking about, to support child care providers in our state. You know, I guess it would have been about 25 or so years ago, I was a child care provider myself. I did in-home child care work. I was a single mom and had 3 kids, and it was the best way to do it. I went to school on the weekends to get a teaching degree, and I understand the value of being a child care provider and the risks that you take, you know, inviting folks into your home and the responsibility of co-raising other children. And for a long time, that position was not, you know, held in such high regard. But I think if it's one thing we realize with COVID, again, how important it is to our economy and the well-being of our families, and for women to have the opportunity to have their children in a well-run, safe childcare position. And our childcare providers really put themselves out there during this COVID-19 pandemic. They stepped up to the plate. They became essential workers, and they provided the important services so that our kids can continue to be a really vital part of our state, as well as women. And so I, again, you know, will always look for legislation and opportunities to support our childcare providers, because we've just seen how many women have left the workforce due to the need for them to be home with their children. And we need to just make sure that those programs are available once again, both for the providers as well as for our families. And so as that money comes through and trickles down into the Senate, I'm sure that the senator and the representative here will make sure that those funds are going to the appropriate places that they need to.
I would just add to this conversation that as many of us who have kids probably know, it costs a lot more to send an infant to childcare than an older child, right? Because of the degree of staffing that's required. And when we look at infant care in Minnesota, the cost of it is equivalent to sending your child to the University of Minnesota for college. So the cost of infant care is sky high. We actually pay, relative to other states, our child care providers pretty well in Minnesota. I'm not saying we can't move it up, but when we look relative to other states, the wages are not bad. And that may be part of the reason we have higher costs. But no matter where we look across the country, infant care especially is very expensive. So on the one hand, we need to shore up these providers, which Senator Franson has rightly said that the state has done a very good job of doing that, also in contrast to other states. And we need to continue to do that because you need providers in the first place, but we also need to help families pay for it. So I saw that Senator Bonner has one note in the chat here about DHS funding that could go to families that receive child care assistance, which is great. That's what we need to be thinking about here. Is how to pay for that. And universal childcare, that would be a dream. I also think that the federal level, what we have right now in the relief plan that passed federally, where we have a child care tax credit that's actually paid out as a monthly payment. And we have two federal level bills, the Romney bill that is more narrow and reduces some other kinds of benefits, and the Democrats bill that is broader, but two kinds of bills on providing child subsidies to families. And that, I think, is the other side of the equation. We have to prop up the providers. We also have to help families pay for childcare because it's worth it. Just as Senator Franson has said, it's worth it to have quality childcare in so many dimensions for the health of our children and for families in the workforce, for their earnings over the long term. I'll also add one other thing, and then I'll be quiet. When we look comparatively at other countries, countries that provide a universal child credit to families, see their women in poverty drop dramatically. And so this can also be a measure that can address poverty levels, especially for single mothers in poverty, which is the groups that we see most often in terms of women in poverty.
Thank you, Dr. Ewig. I have one more question before we move on. So many good questions and just not enough time to ask all of them. But I wanted to hear from Representative Bonner. She's also been doing some great work, and she actually has a bill right now supportive of women. And I was hoping that she could take a moment to talk a little bit about that.
Thanks, Claudia. I'm not sure which one you mean. I have lots of bills that support women. But, we've talked about a few of them here already, and the senators have already talked about the Senate companions to HF 5, which provides more money for child care providers and kind of boosts them up, as well as providing additional funding for CCAP so that more folks can afford affordable childcare or get access to affordable childcare. I mentioned in the chat, HF 1197, which is one of mine. It's a home visiting bill, but what it really does is it targets the most at-risk families. And we know that when we get those little kiddos, when they're young and their minds are just growing and developing, and their little synapses are forming, that we can make a profound difference. We see through home visiting programs, substance abuse goes down, depression amongst mothers goes down, the attachment with their children goes up. The children are actually more prepared for kindergarten. They're ready to take on the world. And what a great world where we can close the education gap before it even gets a foot in the door, right? So those kinds of things. And I think maybe the one you're thinking of is that I've been a pretty vocal champion for another bill, which is the HF 406, I believe it is, Representative Hur's bill. And to be honest with you, I had really wanted to carry this one, but really it's a bill that prohibits previous salary information. And, as women, and as we've mentioned here, a lot of women are the sole caregiver in their family. Their income is it. That's it. And so what we see that over time is that women, when they enter the workforce, get offered less money than their male counterparts. And then we get into this system where we keep basing our salary on previous salary information. So we've already started behind, and that snowballs. And we find that even with men and women, let's say a pediatrician, over 10, 15, 20 years, we see the gaps in those physicians with the same training, the same experience widen over time for some of these reasons. So just making sure that women are getting paid equitably, that we're paying those folks in hospitality, that we're actually putting value to the work that they do. And the pandemic has really laid that bare, that we really just don't do that. And seeing so many women leaving the workforce right now, and I think the senators were spot on. It's going to be a little bit to see that bounce back, and see those women come back into the workforce. So, women are the ones at home doing the homeschooling. They're the ones kissing the boo-boos, and possibly even working at home, doing a full-time job, 40 hours a week online at the same time. So all of those are really great things. The last one I know that was mentioned to me, and I know I talked to Mary about earlier today, is there's a really great bill that impacts women from Representative Richards, HF 660, for those of you who haven't heard of it. And it really talks about the fact that we've noticed that women of color have really high maternal mortality rates and infant mortality rates. And we find that a lot of times in these communities that they are not getting believed when they have pregnancy complications. They're not getting the same level of care. And so this bill hopes to address some of that disparity and really make sure that our women of color are getting the same good care when they go to their obstetrician, to their doula, and that we are doing better by those children and those mothers. So those are just a few off the top of my head. Is of course ERA, which everybody mentioned. One day we'll get there, but certainly those are just a few of them off the top of my head that I know are about women. And lastly, I will just say, somebody asked, how do we get more of these bills on paid family leave and all of these things passed? And I half jokingly, half serious said, we vote for more progressive women. That's not a lie, right? We know the statistics show that when women lead, families, women, and children win. We see that they tend to vote for more bills. They tend to support legislation that supports families and children at a much higher rate. So literally having a seat at that table makes a massive difference. And so I'm so glad that Senator Kunesh was able to join over in the Senate with Senator Franzen, who's always been a champion, and keep that ball rolling. Let's hope we can continue that trend.
Thank you, Representative Bonner. What a great conversation tonight. Now, for this part of our meeting, I'm going to go ahead and pass the mic over to Heather Allison, who will help us on a action activity.
Thanks, Claudia. Hey, everyone. I'm going to share my screen in just a second, but we heard about a lot of bills here tonight. And so our ask is to call your legislator now while we're on this Zoom call and urge them to support any of these bills you've heard tonight that really matter to you, whether it is HF 7 about the earned sick and safe time, that's with the companion oh, no, wrong. Sorry, excuse me. I lost its companion, SF 29 in the Senate, whether it is the COVID-19 funding for childcare and other public health funds with its HF 5. And a bunch of these we posted, and I'll post them again in the chat. The Pregnant Women and Family Home Visiting, HF 1197, SF 1360. Pick a bill, HF 5, which with SF 469. We've heard a bunch of bills. And so what we really want to do is, so Bree just put this in the, mentioned this to me about if we're hearing about these bills now, and tomorrow is the deadline for bills to be heard in their second body. So the first deadline passed last week. Bills have to go through a certain process. They have to be heard by committees by a certain amount of time in the place from which they were originated. So whether it was the House or the Senate, and then they have to be heard in committee and passed by that second body by tomorrow. And so it's been asked, is it really worth it to draw attention and call legislators about these bills tonight? And I say absolutely. I say that, and we all feel it is really important for your legislators to know that these bills matter to you, that they are important to all of us. And there is still time to try to get, for whatever committees are meeting tomorrow, to try to get them heard, to at least get them on the radar, and at least let your legislators know that they're on your radar. And so even if they don't get heard in this committee meeting tomorrow, which we really hope they will, we keep at least drawing awareness to the fact that they exist, that they're there, that they need support, and they need to be heard. And so again, how relevant much of the COVID directly related ones will be next year, we don't know. But again, as many folks here mentioned tonight, Christina Ewig and the senators and Representative Bonner, that this is about, this is a long-term solutions. These are about long-term goals and long-term solutions to ensure that Minnesotans do not, and especially women and women of color and Indigenous women in our communities here in Minnesota, are not as impacted as negatively when the next pandemic strikes, and just for daily life in general. So again, even if they don't make it this year, many bills, will continue to carry forward into next year. So yes, call tonight. It doesn't hurt. So I'm going to share my screen. So it's the time to act portion. So Poll Finder today was not working. I don't know if anyone else had this problem. I don't know how many people go on Poll Finder regularly, but it's a handy website that can help you find out who your legislator is. If you don't know who your legislator is or how to get their contact information, you can go to this website, and I will put it in the chat as well. Once I stop sharing my screen, I'll put it in the chat. And you can find out who your legislator is. So I'll help you with that here momentarily. But what we want to ask is pick one of those bills and phone your legislator. We gave a sample script here that says, hello, my name is so-and-so, and I'm a constituent of yours. I'm calling to ask you to please take action on bill number such and such. This bill is important to me because, and your personal story is really important. This is the thing that makes it resonate the most for them, is that it really matters to you and you have a reason why. And you can tell them you can take action on this bill by signing on as a co-author or urging committee leadership to give this bill a hearing. Thank you for your time. Or you can send an email. And they always like to have the address, if you are a constituent, your address in the email, so then they can verify that you are a constituent of theirs. So same thing, I'm a constituent, I live at this address. I'm writing to you today to ask you to please take action on bill number blah, blah, blah. This bill is important to me because you can take action by signing on as a co-author, urging committee leadership, and thank you. So again, we'd really like folks to take this time now to just quick send an email, quick call. If you don't know who your legislator is, you can go, I just posted it in the chat, and I'm going to just quick type in the bill numbers that we talked about. It'd be sure great If anyone needs help, please let me know, but it'd be really great to have folks just do it quick. You can call your House rep or your state senator, both. You can call them both. And just take a couple minutes while everyone does their emails and makes their calls.
Heather, can you put the script back up?
I can.
Thanks.
I'll just take about 2 more minutes and then. I'm going to turn my share off real quick. Someone asked if we can cut and paste. Yep. So let me do that. All right, I think we'll go ahead and wrap that up. And we're going to be sending out a follow-up email tonight. And also feel free to stay on if you wanted to ask a couple of questions. And then, yeah, I'm going to pass it back on over to Anne to
Great.
close us out.
Great, thank you. I have just a few final remarks, and I'm going to warn the senators and Professor Ewig that we'd also would love to give you the final words. Maybe tell us one forward action or thought we can take away after the session. But I'll give you, or after this session, not the session, but give you a minute to think about that while I mention a few events that are coming up. I think, is Rebecca Larson still
I'm here.
Yes,
Hi.
you have an event that we would like to know more about.
Yeah, just briefly, Indivisible St. Paul is organizing a trip to the Enbridge Line 3 pipeline near Palisade, Minnesota. And we're going on Saturday, this coming Saturday, hoping to arrive at 10 and leave around 4. And the purpose is to just be there in support of the water protectors who have been there for months and months, observing and witnessing the construction that's beginning along the pipeline. And so we'll be there in support and in protest of that destructive pipeline that's going in. So if you want to join us, I can send you the details. I'll put an email address in the chat, and we would love to have more people joining us. So if you are available on Saturday, we'd love to see you there.
Awesome, thank you. Thank you for doing that. It's fun to think of some, more action happening for meetings like this. I was just up in that area on Monday for a rally up there. So thank you for doing that. We have a couple other events that we want to make sure to mention. If you have other events you want us to know about, please add them in the chat or speak out. If you thought the last 10 minutes was awesome, we're doing more actions like that. These times where we meet, learn a little bit about a bill, take the minute to call it or email our representatives. Indivisible St. Paul does that on Mondays from 5 to 6. And we are going to start doing that with Women's March Minnesota. We're going to take time to act on Tuesdays from 6 to 7. I will, if I can multitask, I will post the links to that right now. So we'd love to see you on Monday or Tuesday. With that, I'm going to give the final word. I want to thank our speakers so much. This has been time well spent. It's amazing to hear of Professor Ewig about the data that's coming out about the impact of COVID on women. And it is awesome to hear that the representatives, the senators that we have here, listen to the data. Thank you for listening and acting on the data. That's amazing. And to think a little bit that some of it is that the impact is that we can focus on a resilience for the future. So as I said, if you folks just have a sentence or two they want to say, maybe we'll start, Christina, with you for a thought or an action to move this activity forward.
Reflecting on what folks have said here today, especially the fact that we need to flip the Minnesota Senate in order to see many of the legislative items that you've all been emailing your representatives about really move forward. I would actually say 2 action items. One, work on getting folks elected to the Senate that are going to support your values and the policies you want to see move forward. But also what Senator Franson was saying is we have an opportunity at the federal level right now to push things forward. So also to look at the federal level. And I would reiterate what I said before about the multiple bills on both Republican and Democrat sides for a child subsidy for families. And I think that the fact that we're seeing that on both sides of the aisle right now is hopefully a sign that there could be some substantive movement on that. And so I would say that could be an action item. Look at the federal level and push representatives to move on that item.
Awesome. Thank you. Thank you. Senator Kunish, I'll give you the.
Thank you for inviting me to join you here tonight and for this discussion, and always learning more and more. I think one of the things that we can do as an individual when we see, especially women and women with children who are struggling in some way, I think what's going to happen as this pandemic is hopefully coming to a close is that there are going to be families that are under incredible stress around paying their rent, putting food on the table, paying their utilities. I had one woman call me yesterday. Her utilities are going to be shut off, and can't pay for them, and she's doing the best that she can. What kind of programs are out there for help? We are working hard to ensure that there is rental assistance, that there's landlord assistance, so many different food banks and programs out there to help families through this struggle. And I guess I would just ask if there's an action when you see something like this happening, even if you don't know the person, maybe reach out to them and just ask them, what do you need at this moment? You know, you might not be able to pay their mortgage, you might not be able to pay their rent, but can you go buy them a bag of groceries? Or can you watch their children to give them a break for a minute if you know them? There are those sort of little things that we see day in and day out. Somebody at the grocery store who comes up short when they're checking out. You know, I was one of those mothers once upon a time that was ashamed to use food stamps and often came up short. So if there's one way that you can reach out to families, and it's just not women and children, but men and families of any kind, whether there's one little thing that you can do as this pandemic is coming through, providing books, putting books into little free libraries. I mean, the list goes on. But if there are those bits of humanity that we can do to alleviate just, you know, for half an hour, 10 minutes, or, you know, whatever, please look for those opportunities.
Thank you. Thank you. I can remember some kindnesses myself when my children were young.
Yep.
Just hold her for a moment. It makes a difference. It really does. Senator Franzen? Yeah. Oh, yeah. One woman at a coffee shop held her for a minute. Oh. Senator Franzen, I'll give you a chance.
Along those lines, I think Senator Kunish nailed it. I had support women, whether it's your mom, your sister, your neighbor. Do it daily. I think practice makes perfect, right? That's what I tell my kids already. But the way you put it, Senator Kunish, about the whole family, that's how you support women too, right? If a kid needs help with their homework or anything like that, support women every day. Your sister, your mom, your mother-in-law, the lady who's selling the Girl Scout cookies for their daughters. Hint, hint. I was a Girl Scout. But the other piece too is connecting the dots too. I think with organizations, a lot of times we think we work in silos or against each other, or we don't know what the left hand is doing. There's so many great organizations, and I'm sure you guys have allies, but how do we do that more purposeful? Maybe members of this group right here can say, well, I can be member of the League of Women Voters, they're doing great work, or maybe I can be part of Women Winning in the next cycle and help elect women, pro-choice women, or, you know, I haven't done it before, and or, you know, whoever can extend that network and share this group's knowledge, because I think a lot of people, I just spoke to a group of women at Phillips on their International Women's Day, and people were asking, tell us more about the ERA, one of the questions. So I had my hand out, so I was ready. But a lot of women don't know the history of the ERA and it's you know, where it's at, and I think we still have a lot of work to do in educating, but how can we cross-pollinate with other organizations and share the ERA love? And thanks for all you do, all of you.
Thank you. Thank you. Yeah, that you mentioned before, the Mrs. America on Hulu. You've watched that. So we're not going to kick anybody out, but I really want to thank everyone. The presenters and speakers we've had have been amazing, but the people who have attended have been amazing too. Such good questions, and thank you for the gift of your time. I was a former teacher. You are excused, but you can hang out if you want to for a little bit. We'll be here for a bit, but thank you so much. And hopefully we'll see you at the next third Thursday, or maybe we'll see you on Monday at Indivisible St. Paul's event, or on Tuesday with the Women's March. So
Thank you. Good night.
thank you.
Thank you, everyone.
Okay.